Welcome everyone, and thank you so much for coming today. I am Devin. This is Nicole, Logan, Ethan, and Matt, and we are the Franklinton Healthcare Committee. Our main focus today is making sure that the people of Franklinton, you all, get healthcare better suited to their needs to make their lives healthier and better overall. Today, our main topic is the reinvention of Mount Carmel West. Basically, Mount Carmel Healthcare System started about 130 years ago. The original building was actually Mount Carmel West, which is in Franklinton today. It was started by Mother M. Angela and Sister Rufina Dunn. Now, after serving the community for over a decade, or a century, sorry, it's moving to Grove City. The move will most definitely benefit the people of Franklinton, and that's what we're here to talk to you guys about today. So a lot of you want to know why Mount Carmel West has decided to move to Grove City. And the answer is basically only 3% of the entire Franklinton community uses the inpatient care facility, which would be the hospital beds for overnight stays and things of that nature. Most of the hospital beds are actually used by the Grove City residents. What the Franklinton community uses mainly is the emergency rooms and the emergency department.
Okay, so our committee is interested because we want to alleviate this fear that the hospital is leaving, especially since it's been in the community for so long. So we want to make everybody more comfortable with the changes that are happening. We also want to make you feel more comfortable as well because we know that urban Appalachians have larger healthcare problems. They have greater health disparities than other groups. Asthma is more common. Childhood obesity is higher. Adults even have higher rates of heart attacks, hypertension, cancer, stroke, and back pain.
So for our plan of success, we have 4 key components that we believe will help the residents of Franklinton succeed after the move of Mount Carmel West. The first 2 involve convincing them to keep the emergency room and expand on their nursing program. The next is to install a wellness and prevention program as well as a rehab center. So Logan is going to go through where we plan on putting these programs in Mount Carmel West after the move.
All right, so this is the map that I handed out to everyone. So we're thinking, since they're going to keep the College of Nursing, which is 12 right here, that's going to stay the same, and then we're going to keep the dorm rooms the same, and then also add additional, rooms in the empty inpatient rooms that is in the main part of the hospital right here. And then we're also going to add the rehab centers at 1 and 2 here. And then also have our walk-in clinic as well as the urgent care in the surgery center that's over in 5. So we're going to keep that the same. And then 14, if you look on the map, that's going to be our wellness center as well. So that's just kind of a layout of what we expect to stay and add into the thing.
So like stated before, Franklinton only uses about 3% of the actual hospital beds in Mount Carmel West, as opposed to the 64% that need and use the ER room. So we feel that keeping the emergency department will be very crucial to their success. And we believe through our research that lack of income, poverty, lower healthcare literacy, all relate to this problem. 17.5% of Franklinton has an unemployment rate of 17.5%. Their household median income is about $20,000 less than what we researched urban Appalachians make, about a little over $18,000 a year. So it's a very crucial part that we keep the emergency room because they're waiting to the last minute to get treated for their health problems instead of catching it early, going to visit doctors, and knowing what to do with their health problems.
So a little bit, as some of you may know, the College of Nursing is already there. in Columbus. So they're going to just expand and keep the College of Nursing with what they have now. And honestly, I think this will bring more people into the community. It'll bring younger people in, which will offer more housing, and it'll help the population of Franklinton. And like I said before, we want to renovate the old hospital rooms that are going to be empty and make those into dorm rooms. I think that'll also benefit the community of Franklinton, as well as it offers opportunities for healthcare degrees, which will also raise the job rates in Franklinton. And they can also help with the wellness and rehab centers that we're going to put into Mount Carmel West. And then these are just some of the different types of wellness and prevention clinics we're going to have. So our nutrition, which is going to be in the wellness center. So just like it'll help people come in and, you know, they can focus on healthy eating. And then that can also prevent them from, you know, having these chronic illnesses like diabetes and obesity later in the future. We're also going to do the rehab center, so that'll help with the drug prevention that's really high in Franklinton right now. As well as the education on pregnancy, teen pregnancy, as well as adding the health clinic, the walk-in center, and the urgent care. I think those will help the emergency room too, so they're not as busy, you know, kind of have those like, just if some people get like a short like sickness, they can come in and get treated for that. And then we're also going to add the exercise plans in there and have like instructors and just really focus on, you know, healthy living in Franklinton.
Okay, with the Rehabilitation Center, one of the main problems in Franklinton is drugs. So we're trying to move more to a prevention phase instead of actually after it happens.
Poor Marty. You just have to be careful not to press down.
So we're trying to move to the prevention phase of it. So instead of after somebody's already addicted to the drug and then trying to wean them off, we're trying to prevent, so at younger ages with education. The other problem is in Franklinton right now, the big drug is heroin. Everyone in here probably could say, oh, I can try it once and I'm not going to be addicted. That's what many of the kids our age, younger ages say, but in return, they say one hit and you're addicted to it. So we're trying to move to the prevention where when you understand what the effects are to your body at an earlier age, you won't be that person that says, oh, it's not going to change me. With the physical and mental health care, when you're with Franklinton, with the lower class and stuff, we feel like with physical, with your physical care, you're working harder jobs, you're not sleeping as much, you're trying to work more time to be able to pay your bills. So we feel like if we have a better physical rehabilitation center with physical activity, with instructors that can help you get your body to a healthier standpoint, this will help big time with Franklinton area. The abuse, like we said, is just huge in Franklinton. Everybody, or not everybody, but most of Franklinton is they drink a lot or they do use the drugs. So we're hoping to get individual and group counseling. Not everybody wants to go and sit in a room with a big group and say, yeah, I have a problem with drugs. So we're hoping to get into more individual groups or individual one-on-one sessions to help with people so that they can really understand what it's doing or how to get themselves out of the mess that they're in. With the behavioral health issues, with the behavioral model, it's kind of like setting a plan towards something. So we're hoping that with the behavioral group, you would be able to sit down and map out a plan for what you want to do or what you need to do with your health in the rehabilitation center type deal. How this will end up benefiting Franklinton. The big problem with Mount Carmel leaving is just the fear. Everybody thinks it's kind of a bad thing. They're losing the hospital. We think that it's actually going to help lower drug and alcohol addictions by creating awareness. We think that it will actually benefit Franklinton. We think that with the wellness and programs in the rehabilitation center, education will rise too. There's not many places right around that area that you can just get easy access to go get her rehabilitation and stuff. With Mount Carmel West being right there in Franklinton, it's very close, so you can get to it and easy access to get education. We also think that it will open more jobs for people. When you have, as far as instructors, wellness people doing the wellness clinics, stuff like that, there will be actually more jobs for a Franklinton community than there will be compared to just having the hospital where it's nurses, doctors, people to that, where they think that with Mount Carmel leaving, it's going to actually make less jobs. So we think that will actually increase. And we think it'll just be a better sense of community involvement. One of the small business owners, when we went on the visit, said that when Mount Carmel leaving, it will actually hurt because their businesses won't have people to come in with, like the nurses, the lunch hours, stuff like that. With making the College of Nursing bigger and the dorm rooms, adding apartments, we think that will actually increase their business. Many college students want to go get a quick lunch, want to go get something in between study breaks, a coffee shops, stuff like that. So we think it'll actually help the small businesses in Franklinton by moving to this. All right, any questions?
Don't they have a resource center in Mount Carmel that helps with things?
Yeah, they do. They actually have many programs. We detailed it more in our report. I know they have a lot of pregnancy clinics for women who aren't really sure how to breastfeed or how to be a new mother. They also have Tai Chi was one of them. So they do offer like some fitness classes. They offer some cooking classes. We would like to expand on that, kind of introduce preventative health clinics, things that, if you take care of yourself this way, if you sleep more, whatever it may be, you're actually going to end up being healthier. They don't really have anything like a health class. They have, cooking and I would describe like lifestyle classes, like a teen living, which is what I did in high school. They teach you basic things, but they don't really detail into the health side of things. Anyone else? Yes.
How will people get the training for these new kinds of jobs? I mean, I agree that there may be more jobs, but how do the people in Franklinton get the training for those jobs?
Well, we could offer, training sessions for people to come in and get that knowledge, almost like classes. So I think that would be a good opportunity to get people involved in the community and just coming in and, learning the basics of how to run a business or how to teach a wellness class or anything like that.
So you're thinking that perhaps connected to the college nursing program, that there might be actual classes about how to sustain some of these jobs?
Yeah, kind of like not so much, have the nurses in the College of Nursing do it, but they would help out with it.
Yes.
So I think
All
that would be,
right.
yeah.
And then also on top of that, I know that the College of Nursing focuses mainly on RNs, but there are lower level like STNAs, LPNs, and they're shorter and a lot cheaper. So if we can find a way to get the citizens of Franklinton into those programs, maybe offer a really large discount. Obviously, there's financial aid, but if you start them at that lower tier, they can start to build up and get to their RN or whatever they desire that way. Anything else? All right. Thank you all so much.